It's really nice that we can look out there and see so many people we know. So thank you guys for coming today. I'd like to introduce my wife, who is the hero of my life. She's Cyndy Martin. She's on the board of the San Diego Foundation. She is the treasurer, mother of two. I'm the other father of two. I'm Bill Martin. I'm actually the president of the board in San Diego. But more importantly, Cyndy had a transplant, stem cell transplant, back in 2012. She's 20 months post-transplant. And we have been honored today by the Scleroderma Foundation to come talk about our journey. And we hope to share that with you, and also some information about what this is and what this is not. So thank you guys for coming.
Thank you.
So a couple of quick things here. We are not doctors. We don't have any degree in medicine whatsoever. We have not gone to college to study this. But for the last 3 years, probably on a daily basis, we have studied and we have learned and we have researched this. We have talked to people on a daily basis, and this has become our life for the last 3 years. So from a patient's perspective, we're probably more informed than 99% of the people out there, and that includes a lot of rheumatologists. But we are not doctors, so therefore what we say is our own personal opinion. And that's something to be very careful of, because we want to make sure we have no initials after our names. So if you look at the rest of those people, there's so many initials, it's ridiculous. So I also want to talk about the conference for a little bit. We have been coming here for 5 years. The first year we came here was in Boston, and we were like a lot of new people here for the first time. We had absolutely no idea what we were going to expect and what we were going to see. And at that conference, we found out almost after the first session that my wife was on the wrong drugs. She was on a drug that was used back in the 90s, and there was no longer being used anymore. So these conferences not only are important, but they can change your life, and we're so grateful for them. In 2011, we had the opportunity to be in a room like this, and we got to listen to two researchers, one from the Scott trial and one from the HSCT trial. And they sat down and they presented their papers to us, and it was amazing. It was emotional, it was hard. We listened to this stuff and we went, oh my God. One was saying you shouldn't do it, it's too dangerous. As a matter of fact, the gentleman that just spoke, Dr. First, was in part of that group on the Scott trial. Too dangerous, don't do it. And we had another doctor on the other side, Dr. Burt, saying you need to do this as soon as possible. And as patients, what do you do with that information, and how do you process that? It was really tough for us. We walked away saying, we think this is the thing that we need to do in case Cyndy ever got sicker than she was. 10 months later, after that conference, Cyndy was diagnosed with lung disease. And at that point in time, we made a decision that day that this is something we wanted to pursue. So we started learning more about it. 2 months later, 3 months later, we were actually at this conference, and we thought we had made the decision, we had been tested, she was approved. And we thought we'd come here, and this is in 2012, we thought, great, we're going to come here and get a lot of support and everything else. And there's still a lot of controversy, and there's a lot of people that were saying, you shouldn't do this, and there are people who were saying, you should do this, and it was confusing for us. But here's what we got from that. We got information, and we got questions that we got to ask. You know, and I think that's true for this conference. You get to go home and ask questions of your rheumatologist and your specialist, right? How does this fit for me? Does this work for me? And that's what we got from that. A few months later, Cyndy had her stem cell transplant. It worked really, really well. And the next year we came back here, and it was like she was a little rock star. Little bald-headed rock star, you know? And there was a story about people were approaching her in the bathroom. She was trying to wash her hands, and they would say, are you that Cyndy Martin that had that stem cell transplant? Because it was still pretty new, you know? And that was just 2 years ago. So it was still, you know, one of those things where people were looking at but didn't know enough about. But we also came to learn, and we still come to learn, and we came here this session to learn. We're here not just to give a presentation, but we're also here to learn. And it's so important. And this time we were actually offered the opportunity to speak and to share our story. So we're glad that you guys are here. So what is this Haematopioetic stem cell transplant? The proper terminology is HSCT. I'm going to refer to it as a stem cell transplant. And the reason is I can never pronounce the first word, and I have yet to find someone else to pronounce it. So what is this? The basic concept is this. Your immune system is attacking your body. If you turn off your immune system and reboot it, much like you do a computer, if you turn off that computer and you wipe off the instructions and you load up new instructions, will your immune system no longer attack your body? And that's the concept. It's not really a stem cell transplant because you really don't transplant stem cells. What you're really doing is using chemotherapy to turn off the immune system, and you're using your stem cells that come from your own blood. So you really don't get a transplant because transplant usually refers to somebody giving you something. These are yours. The stem cells are not treated. They are not embryonic stem cells, although there's one case out there that I know of who had that done, and she's here with us today. But for the most part, we're not talking about all that. We're just talking about getting your own stem cells back, and they're only used to get the immune system started again. So what this is not a stem cell treatment. They do not treat your stem cells. As a matter of fact, they freeze them, put them away for a couple of weeks, and then they thaw them out and put them back in. There's nothing done to your stem cells. But that's the terminology we use. We used to call it a bone marrow transplant back in the day for leukemia and lymphoma, okay? Real simple stuff. We're going to shut down your immune system. We're going to turn it back on again. So how does this work? So the first thing, and I think you heard this from Dr. First today, there's a lot of stuff around this that's dangerous because you're getting high-level doses of chemotherapy. So the first thing they're going to do is they're going to test you. They're going to do a lot of tests for you. They're going to see if you qualify. And if we're talking about trials, which we're talking about, in a trial, you have to make sure that you're sick enough, not too sick. You got to make sure that you're not too far down the road, not too old, not too young. There's a lot of different things that go into this, but they're going to test you for all that. They're going to test your heart. And this is a good time to talk about the heart. So we found out that if you heard the Scott trial and you saw the data from the ASSIST trial, and you saw that big steep drop-off of mortality. In 2012, a paper was published by Dr. Burt out of Northwestern that really talked about the problem with stem cell transplants for scleroderma patients is that we have stiff heart. And by understanding what that means and understanding how to test for it, they've been able to reduce the mortality rate down to about 5%, 6%. And that's actually a large number, but it's actually probably smaller than that, and it really depends upon the center that does this. But it's a lot different than it was 10 years ago. So you get tested, and that's the one thing they test for. Then you go to mobilization, just a big word for saying we're going to take the stem cells in your bone marrow, that's where they reside, the immature stem cells, and we're going to force them into your blood system. So you get them into the blood system, and then you can retrieve them. So mobilization basically is just moving them, takes about 10 days, a little chemo, some shots in the belly, not so fun, but you get them out there, and then in about 10 days later, you get hooked up to a machine. And if you ever had apheresis done, or if you ever given blood, this is very similar, except that they go through your neck. And yes, that is tubes going into Cyndy's neck. And they're taking the blood out, they spin it, they take out your stem cells, and the stem cells you can see up there in the red and white bag, that's where the stem cells are. And they put all your blood back in. Takes about a day. Your goal is to get 2 million. Cyndy was a little bit of a rock star. She got 8 million. The other day I heard somebody had 17 million. So it takes about 2 million stem cells to reboot your system. So that's what you're going for. Once they have those, they put them in their freezer, you might say, with their name on it, and then they just sit there until you're ready. The next step is chemotherapy. This is when you enter the hospital. This is about a 17-day stay in the hospital. Brittany is here's your hand, Brittany. She's the one that's in the picture here. So this is when your first 6 days in the hospital, you're getting your chemotherapy. And it can vary depending upon what arm you are in there, but basically the main part of this is about 4 days, 5 days of Cytoxin. And you could have a sandwich, what they call basically is rituximab at the beginning or the end. A couple different ways of doing this, but the real reason why you're doing this is that you're destroying your immune system as much as possible, okay? You're bringing it down to a low level so that it's gone, so you can get your stem cells back. So they call that -6, -5, -4, and so forth. On day 0, you get your stem cells back, and this is really simple. They thaw them out, they put them into an IV, and you can see them, the little red area on the machine there, and they just put them back in your body. That's simple, but it's one of those emotional days because that's the day that you start your new life. And then you wait, and you wait. This is also the most dangerous time period. Usually it's a couple days before day 0 and about 3 or 4 days after. These are the time period when you have no immune system. You feel like a Mack truck hit you. Some people describe it as a really, really, really bad flu. But this is the hard days that we go through, and it takes about 10 days. And about 10 days later, your body does a remarkable thing. It basically starts producing red blood cells, white blood cells, your new immune system. And watching somebody hit this day is like watching somebody change hour by hour and get happier, healthier, and stronger. And it's really an amazing thing to watch. And really what happened is your body's coming back to life. You might say, some people explain this as like going to hell and making a U-turn, right? And the reason we say that is this is not an easy procedure. It's an expensive procedure, but it's a procedure that is amazing when it works. So let's talk about clinical trials. This actually wasn't something that was presented by Dr. Fursis a little bit ago, but I'm going to show you all the trials that have been out there for the last 14 years. So the ASSIST trial, which is the one that he referenced originally, started in 2001 in Europe. Great trial where we've got a lot of results from, and those papers have been published. The Scott trial has not been published yet, but it had started, but then they put that, they no longer recruit for that trial. It used body radiation for that. The other trial that came out was the ASSIST-1 trial. That paper wasn't shown up in that presentation, but the ASSIST-1 trial has been published also. There was 19 patients in that trial, and 2 of them are in this room tonight, or today. That was a great trial. It showed us an awful lot about, that was a Cytoxin-only trial versus a stem cell trial. They don't do those anymore, but that trial had great results as far as understanding what was going on. The STAT trial was currently done by the rheumatologists in this conference, unfortunately was put on hold. It's been on hold for about a year, but I'll come back to that in a minute. And the ASSIST-2 trial, which is in Chicago by Dr. Burt, is the only current trial that is actually recruiting for stem cell transplant. So if you want to be in a trial, that's the only place in the U.S. you can go right now. And then there's the ASSIST-MOMA trial, which is basically it's the new trial in Europe. It's out of Germany. And I'm happy to say today that Dr. Furst and I talked yesterday, and he told me that the STAT trial, which has been on hold for a year, will be starting up again, and they will be accepting patients within the next couple of months, and they should start treating within 3 to 4 months. And that's going to be in 4 to 5 centers around the United States. Hopefully one in LA, probably Seattle, Denver, most likely Boston, and probably someplace else. But that's great for those of you who are interested in stem cell transplants, because you need more of these out there. And all these places that we can go to now make it more important for us to progress this treatment. So now let's talk a little bit about why we're here with Cyndy, and a little bit about our life. In 1999, we were married. We met on a blind date. We both had 1 daughter. We got married. We raised our daughters together. We traveled a lot. We scuba dived. We were runners. We worked. We raised money for charities a lot. We spent a lot of time running and raising money for charities, running marathons. We had a really good life. In 2001, we moved to San Diego and continued that kind of lifestyle. In 2009, we kicked our daughter out. I'm sorry. Our daughter went to college, and there she was able to, she went away, and we said to each other, oh, we're free. And then scleroderma hit and changed everything. It started off, and she'll talk about it, but it started off and we didn't know what it was. And eventually we found out she had scleroderma. We had to refocus our life. In 2012, she got worse and worse, and we finally had to have that stem cell transplant. We believe that she probably had a 30% chance of living 5 years, and she was already 2 or 3 years into it. So our decision was to if we had to pay for it out of our own pocket, we would take it out of our retirement savings, and we started our life together. Oh, I've got to show this slide. This is the jungles of Papua New Guinea, and we're up there in a place like the Sing Sing Festival. So we traveled all over the world scuba diving, and that was our passion. When we first met, that's what our passion was. So this is a good chance for me to turn it over to my wife, and I can shut up.
Yeah, he always takes me to dangerous places. It's not a good thing.
Yes. This is probably where she got scleroderma.
Could be. A poison dart, who knows? I don't know. Well, I want to talk about my road to diagnosis. I'm sure it's similar to many of your stories. It just starts out with way too many of those typical middle-aged symptoms. You know, I had bruised tailbone, bruised elbows. I thought I was sitting too hard on that yoga floor. A little digestion problem, a little brain fog and forgetfulness. Boy, it just seemed typical. And the carpal tunnel hit, and the swelling. Oh my gosh, the swelling. My family doctor wasn't taking any of this too serious. He just kept saying, it'll be okay, go home and rest, it'll be okay. And I kept calling him, no, Derek, no, this is a big deal. Something big is happening. And it took quite a while before he would take me serious. So all those symptoms that I noticed were starting in September 2009. By January 2010, Derek caved, and he sent me at least to the neurologist for those darn carpal tunnel. And that was sort of a turning point in my mind, because the neurologist said, Cindy, you realize the carpal's not causing the swelling is causing the carpal tunnel. I went, oh, let's focus harder on that swelling. So he did a blood test. It was the ANA. And he called me, he goes, well, you have this thing called the ANA, it's slightly elevated, but it's unremarkable in a woman your age. I'm like, really? Come on. And so you'll be happy to know, months later, when I knew what was going on, I sent him an email and told him the rest of the story and said, dude, you had the answer in the palm of your hand. You just didn't know how to read it yet. And I want you to know what it's like for the next carpal tunnel patient that may have a slightly elevated. That was good. April 2010, I finally saw a rheumatologist. She pretty much knew what it was when I walked in her office, but of course she runs those 23 blood tests, x-ray of my hands, on. And I went and I looked up the meaning of every single one of those 23 blood tests. So by the time I went back to see her for the reading, I knew. I said, I think I know what I have. And she said, what do you think? I said, scleroderma. She said, yep. And the tears started welling in my eyes for 1 second, and then I sucked them back in. I swear I sucked them back in. I am not going to fall into this. I've got a diagnosis, and now I can have action. That was relief to have a diagnosis, and I'm sure a lot of you felt the same. A few months later, I made my way to the GI doctor, because the GI was a big problem. And he was amazing. He was a really understanding doctor that knew scleroderma. He happened to have a resident visiting his office that day. He goes, do you mind if I bring in the student? We do a little teaching. And that was the first time. And ever since then, I'm like, come, touch, see, feel. So the resident came in, and he touched my arm, and he said, wow, this is amazing. How many years have you had scleroderma? I only had it 3 months. So the GI doctor said to me after that guy left the room, he said, Cindy, I'm very concerned about how rapid and aggressive your case is. By that summer, I was already a skin score of 30. That was really fast. So I found out my 30 because I had found my way to UCLA. The amazing doctors at UCLA were on my case. Dr. Dinesh Khanna was at UCLA at the time. You guys may know him. He's leading the center at University of Michigan now. For a while I said, Bill, we're going to have to fly to Michigan because I'm not giving up Dr. Khanna. And then I was blessed to have Dr. First right there. Dan First would pop into every one of my appointments as well. So I had 2 of the best docs in the country every time I went to visit UCLA. And my pulmonologist at home had sent me with a little disc with a little image of my lungs, and UCLA looked at this little tiny black and white image. And Dr. Khanna said, I don't know, I can't tell from this. I need a bigger full color image. But First knew what he saw. He walked in, oh, ground glass and fibrosis, absolutely, gotta go, pop. I'm like, what do I do now? What do I think now? So I went home to my pulmonologist, and the lung debate began. And my pulmonologist at Kaiser had an image this big, full color, 3D. He flipped it around, reversed it every which way. He says, Cindy, I don't see what he's talking about. I see nothing. They look clear. So that's where my insurance was. That's where my regular care was. So with the big doubt in my mind, I waited 2 years. It took 2 years, and then finally my pulmonologist gave me the diagnosis of interstitial lung disease. By then he could hear the rails when he listened, the crackle sound in the lungs. And then my new chest CT really showed fibrosis and ground glass. It was real. That day I felt like my health became an emergency situation. That day I believed my life expectancy crashed. It's a very big deal. So what do? I call my scleroderma sister, Holly Hauser. I'm so blessed to know you. You know how much I love you, and I want this whole room to know that you are an amazing force in my life. I know that God sent you at just the right moment. Holly is a physician as well as a patient, and she had the same stem cell transplant 2 years before me. So when I called her, I had heard about this stem cell transplant at the San Francisco conference. I kind of knew what they were talking about, but put it in my back pocket for later. And now I took it out and I said, Holly, help me. So she met me and she brought the literature and she could explain the medicalese, and we went through it. We talked about it. And that led me to getting my transplant in October of that same year. Let's look at my test scores. So my skin, I told you I was a 30 right away from the get-go. At this point, by the time my lung diagnosis, my skin was about a 35. For those of you not familiar, 52 is the hardest and 0 is normal skin. So I'm kind of up there on the scale. My lungs tell the most of the story. The DLCO is the big one. In my first year, I dropped 10 points, and the next year I dropped 26 more points. So 80% or above is considered normal, and 60% or below is kind of the danger zone. I was on methotrexate during all this. Methotrexate did nothing to slow me down. Once they told me my lungs were involved, I started some of the Cytoxin infusions while we worked on getting into transplant. In case I didn't get into transplant, let's stop what we can while we can. And Cytoxin was helping a little, but all the literature shows, and all my doctors tell me, that only lasts a year or two. So we had to move on. So as I said, my lung function was crashing. I had no idea when it would stop. This is another time that Holly and I would talk. Where's it going to go? Is it going to stop here? We don't have a crystal ball. We have to make our best guess for ourselves. Do we want to gamble that this is going to level out here and I can be okay? Or am I going to crash below the 40% where you're no longer qualified for the clinical trial? Are you going to crash to the point where you need oxygen and lung transplant? That was a terrifying thought. At the time, what I was reading is if your lung function was below 60%, you have scleroderma, ILD, lung function below 60%, I read I only had a 30% chance of surviving 5 more years. That scared me. It felt real to me. Another doctor who I very much respect said, with that statistic, you have a 50% chance of surviving 5 years. Very scary stuff. So I wanted to be as aggressive as my disease. That's another phrase I got from Holly. She gives me lots of good phrases. I want to apologize if this is the first time you're hearing some of these scary statistics. I know when I was new and I heard this rotten, horrible stuff that was terrifying and sickening, I was kind of angry at the people who just blurted it out so cavalier, and I do apologize, but I don't want you to get sucked into believing the doom and gloom. What I did is took those statistics and found action, took action. One doctor's not enough, one opinion's not enough. I did my research, I did my learning and talking and double checking and triple checking to change those statistics in my case. So I encourage you to find your path, do your education. Don't copy me. I'm not saying this is for everyone, but make your own statistics for yourself. Well, based on everything, the clinical trial documents, the conference in San Francisco, meeting with Holly, I also, here's another amazing God moment, a blessing. I got my ILD diagnosis on a Wednesday. That Saturday, Dr. Burt came to my town to talk to us at Education Day. So I got to meet him and hear him talk. I got a private consultation in the back room. And I met this man with great passion for saving lives. And he really, really wants to save lives and make this happen. He's been working for 18 years on 23 different autoimmunes with this stem cell transplant. Just amazing. I loved it. I did one more thing. I found some other patients. I found Victoria Chavez and I found Ken Athens, and they have very detailed blogs on the internet, but then that wasn't enough for me because I got to triple check things. I've called them up on the phone and asked all my questions, and they were wonderful to me, and all this together helped me make my decision. But I did write down my pros and cons. So my first objection, the first objective of stem cell transplant is to stop the progression of the disease. It's not to cure you, it's not to put you back to a whole healthy body. It's only to stop the progression. I thought, okay, I can live with where I am. I could be here to see grandbabies where I was. I thought that that could very much increase my life expectancy. And icing on the cake, I heard people who had their lung improvement. So I wanted that maybe, but I knew I couldn't count on that. I kept asking for the Ken Athens plan. Ken Athens and I had pretty much the same stats going in, skin and lungs, and he was a golfer, he was a runner, he was a scuba diver. Hey, I do all those things. He couldn't do them anymore once he got scleroderma, neither could I. But guess what happened after his stem cell transplant? That man ran his first full marathon less than a year after his stem cell transplant. So I'm asking for the Ken Athens plan. The cons, let's be serious, it's not all happy days. I can't be a nonstop cheerleader. This could be a life-ending procedure. It's a rough treatment. You have to be willing to take that risk. The mitigating fact to me is that Dr. Burt had shown in ASSIST-1 that he could get the mortality rate down to 5 or 6%. He knew that phase 1 deaths were related to heart problems, and he modified his treatment and began doing very extensive heart testing before he would allow patients into the program. Another risk is it could fail to stop my disease. There is a 30% relapse rate. It's not great. We say another Hollyism is, this is not a very elegant treatment, but it's the best we got. What else are you going to do? And it's in clinical trials, so some of your doctors may be afraid to send you there. But we can't wait 10 years for the results to come out. We can't wait 15 years for a consensus between all these different trials. To me, there's many doctors around the world who believe in this, and I believed in Dr. Burt, so it was a risk I was willing to take. It would be a very long commitment, and as Holly and I said to each other on the phone and in person, it's going to suck, huh? Yeah, it's going to suck. It's going to really suck. How much is it going to suck? It's going to really, really suck for a little while. And then it's not funded. The money's a big deal. Let me talk about the money for a minute. It costs about $175,000. It's not funded. So that is the cost of both the evaluation, which is about $20,000 to $30,000, and the treatment, $125,000 to $150,000 for treatment. Most insurance will cover it. I've got a friend here from the UK. She doesn't have US insurance. She had to come up with every penny. In our Facebook group, I have several Canadian friends in our group. They had to raise every penny. So it's tough. In the end, I only paid $2,500, my hospital copay. So how did we get it done? I requested an outside referral at my HMO. My rheumatologist and pulmonologist, they were a little slower on the uptake than the good UCLA guys, so they had to talk about it a lot. My pulmonologist was good. He goes, well, let's think outside the box. If you see any clinical trials or anything experimental that you want to try, run it by me. Let me look into it with you and for you. And so I said, here's a CIS trial. I want to do this one. Read it. And my rheumatologist said, okay, let me call this Dr. Burt guy. And they talked for an hour. And then she says, okay, I don't know if you're going to get approved or not, but go get the evaluation. Just go to Chicago. So I went and let them do their thing. Evaluation takes 3 to 5 days. Mine happened to be spread out over 5 days. It doesn't mean I got more testing than the people who do it in 3 days. Mine was just a slower pace, which I was grateful for because there's a lot to do. It's exhausting. There's a lot of anxiety. You get labs. We've all had blood draws, no big deal. PFTs, we do that at home, but they want their lab to do it. That's fine. The right heart cath is a whole nother animal. I'd say most of the people that join our Facebook group ask the question about this the most. What about that right heart cath? Is it painful? Is it difficult? I would say it's not painful. It's just weird and awkward. They go in your neck and they put something inside your heart to measure the pressure. Are you kidding me? I'm wide awake and you're going in my neck? I have these crispy bits, so I feel like it got stuck and I had to push through the crispy bits. And not everybody says that happens, but that's what mine did. And the first test was fine. Everybody's playing the music in the treatment room. It's going fine. And then they add the fluid to test if I could tolerate the fluid, and that test didn't go as well. So I began to have an anxiety attack while they're saying, shall we continue? Is it okay to continue? Do we push more fluid or not? What do we think? Can we continue? I panicked. I'm shivering like I'm naked on an iceberg. It was anxiety, man. But it wasn't painful. It wasn't painful. So I got through that. Then you have an extra long MRI. Oh, the stress echo test. I don't like that. So I wasn't in great shape for running, so I had to lay on the table and kick my legs as if I'm running, and then that's not enough to get the blood pressure up. So they give you that adrenaline shot. Holy cow. I told that technician, get ready, I'm throwing up on you. It's not a question, it's happening. Then you visit with a cardiologist, a rheumatologist, an immunologist, and they evaluate you, they talk to you. Two of them said, are you sure this is what you want to do? There are other options. There's other meds you haven't tried yet. And we talk through those. And they make sure that this is really what you want to do. This is serious business. I think Bill talked about the heart risk a little bit. That's the biggest, most important thing to understand before you go into transplant, is how is your heart involved? Is it involved? How extensive? My cardioechogram, before, during, and after, still today, is normal. But I have heart involvement. I have scleroderma stiff heart. I didn't know that until I was in Chicago and they did that right heart cath. So Dr. Burt said, okay, you can go forward, but you have this stiff heart. You're a higher risk. Are you willing to go forward with a higher risk? You'll be right here in the hospital with experts who understand what to do. We can react to this moment, but it is higher risk and it's your decision. So I got my approval, move forward. Now it's time for the insurance. This is a wait, work, fight period. Dr. Burt's office tells us it's an average of 2 months. For me, it was more like 3 months. And remember, my pulmonologist and rheumatologist were discussing it, and they were sending in my referral. It went in, but it sat in committee for about a month. The committee was mostly cancer doctors who do bone marrow transplants for cancer patients. They don't know what this scleroderma stuff, sclero what? And what do we do for this? We have no idea what to do for this. So it got stuck. The chairman left it sit with no answer for over 100 days. Some people get a denial, then they can go appeal and get an attorney. I got nothing. And so I found the California Board of Managed Healthcare. I found the Patient Services Department at my Kaiser Healthcare Center. And the patient service manager said, you need to file a complaint against us. You got to go to the Board of Managed Healthcare. I'm like, well, I don't know. We have a lawyer friend who made a call to his friend who was the vice president of public relations of Kaiser. And so he was putting pressure there, and I finally filed my claim at the board. Kaiser was fined. You don't leave somebody's referral sitting for 100 days with no answer. Less than 24 hours later, I got my approval. In the meantime, I want to tell you about the cash option because we thought, we're doing this. I'm not waiting. My life feels in danger. So we transferred money out of my retirement fund because if you're not going to be here, why do you need a retirement fund? So the money's sitting at B of A Friday. I was going to go get the cashier's check Saturday so that I could fly on Sunday to start treatment on Monday. So Friday night at 6 p.m. is when I got the phone call. You're approved. Here's your authorization number. Phew! I got the approval. The money can go away. Now we can think about other things. So we moved to Chicago. Another blessing, another God thing. A dear friend of ours from San Diego got a job transfer to Chicago. And he bought the most beautiful 3-bedroom apartment overlooking Millennium Park, about a mile from Northwestern Hospital. So we moved in, and we had 2 bedrooms, one for Bill's office and one for our bedroom. And Mike's a bachelor, and I got to take good care of him. And he was my protector. He's a former Army Ranger. If you know Army Rangers or Navy SEALs, they are intense protectors, and that's who I had on my side in Chicago. It's pretty darn cool. Okay, time for mobilization and harvest. So mobilization is just using 1 night of chemo. So you go in the hospital for 1 night, get a dose of chemo just like you would if you're getting Cytoxan at home. So I got the wasabi nose. I got a lot of fluids and had to go tinkle all night long. They're testing to see how well my heart was tolerating all that fluid. That is moving those stem cells, production up, make it produce more. We need a lot of stem cells. Then we go home and do those shots in the belly. I don't want to give myself a shot in the belly, do you? And you know what you have to do? You have to find your belly fat. Who wants to say they have belly fat? Let alone pinch a hunk and say, here, honey, stab me in my belly fat. But that's what I had to do. I couldn't do it myself. He flinched during the first shot. That's why I couldn't do the second one. And it was 2 every morning. We got the hang of this. I found a cute French bakery, and I'd go pig out after each morning of shots. There was some bone pain at this point. Tylenol was enough some days, but I had to use some narcotics some days. The bones just don't want to give up those stem cells, but they do. They kick them into the bloodstream. Then it was time for, I got the harvest, and 2 million is the minimum. I got my 8 million. Very rarely people go back for a second day. So I was lucky to be one of those one-dayers. Then my resting time, hung out in Chicago. Some people go home. I decided, hey, I got this beautiful apartment. Why am I going anywhere? There's no kids at home. Not even any more dogs or cats at home. And besides, my buddy Michael needed help decorating the bachelor pad. We went to Home Depot, we went to antique shopping and restoration hardware, and I think Bill likes to say I was good for about 4 hours a day. And so we'd go do this for about 4 hours a day, and then I'd nap, and then I'd cook for the guys, and it was kind of cozy. Mike said, I gotta have this blind date. You gotta go find me a blind date in the hospital. So my mission was to find a doctor or a nurse, and I did. I hooked him up on one blind date. It didn't go very far. That's okay. Okay, now it's time for the hospital stay. That's what I call the big show. Actually, the day before you get admitted to the hospital, you go in for a PICC line. A PICC line is basically an IV that's going to stay in during the whole time. It goes about mid-arm and reaches into your heart. Guess what? Those crispy bits were a problem again. So some people, that IV PICC line slides right in. Not me. It was a 4-hour procedure for me. I had to wait for the doctor and the x-ray machine, and they had to be able to see where they were going to drive it around those crispy bits, and they scratched a few things. Have you ever swallowed a tortilla chip sideways and it scratches? That's how it felt for about 4 days. But we got the PICC line in there, and I was grateful because that meant it had 3 nodules. They could put all the drugs in, they could put the fluids in, blood transfusions in, and they can take all the labs out. No more needle sticks. I was grateful for that. Now it's time to get in the hospital. At admission, we met Arian Moore. He's my hospital buddy, and Bill adopted him, and Arian's been my little brother ever since, my basketball-playing little brother ever since. He has scleroderma as well, if you know him. Chemo starts. They count it off as day -5, -4, -3, and so on. And day 0 is the day you're going to get your cells back. You get a Foley catheter as well. This is another not painful but pretty awkward kind of situation. So the chemo is high risk for giving you bladder cancer. So to counteract that, they give you the Foley, which flushes your bladder constantly with fluid for 5 whole days. So that puts the fluid in and it takes the fluids out. So it's convenient. I could still walk, and marathon coach over here had me walking the floors. So I walked and walked and walked. Day 0, got my stem cells back. We had the pastor come and bless the cells. It was an exciting morning, take pictures with the doctors, and then I crashed. Then the flu-like symptoms got much more intense. I had an Advent calendar. One of my cancer friends, she's a 3-time leukemia survivor. She knew all about this kind of stuff. She made an Advent calendar and put a scripture card in every day. And then family and friends, since they weren't going to fly out from San Diego to Chicago, they gave us little things to put in there. I had lots of little trinkets, and Bill and I would look inside a pocket every night before he went back to the apartment. Then it started getting very, very challenging. I have watermelon stomach. You may know what that is. The blood vessels are too close to the surface. So with no white blood cells and no platelets, that started bleeding. I think I had 8 blood transfusions and 11 platelet transfusions. What else can I tell you about this? I began to become so fatigued. One day my nurse came in and said, hey, we're going to have a better day today than yesterday. I just know it. I'm like, I have never met you before. She's like, I took care of you all day yesterday. A little while later, I looked down and I go, oh, hot pink shoes. Yes, I did see you yesterday. That's all I saw. Bill would watch movies and I wouldn't open my eyes. I was just so fatigued, I can't explain it to you. Walking from the bed to the bathroom felt like some kind of marathon. Taking a shower sounded like way too big of a job. but we did it anyway because it's important when you have no immune system. There were 3 days I don't think I opened my eyes. And nearing the end of those 3 days, I heard some music. I thought it was harp music. And seriously, I was asking myself if I was in heaven, if I had died. So I took a few minutes listening to that beautiful music, started thinking about the alternatives, like, well, maybe that's not what it is. And I opened my eyes, and then it's like, oh, that's not a harp, that's a flute. What is that? And I got up out of bed, and it was a turning point of energy. I stood at the door and listened to this flautist. A student musician had come to play for the patients, and the tears just flowed, and I felt magical that I could stand up and enjoy that music and know that I wasn't really in heaven.
Yeah, this is probably a really good time for me to talk about those days. So we talked about the hard days, and in my heart, I thought we were going to lose her. And that's because she gained 17 pounds of fluid in 3 days.
It's okay to call me Uncle Fester. I know I look like Uncle Fester.
Actually, I thought she was pregnant. And it's also a good time to talk about caregiving at this point. So for every person that's in the hospital, there's somebody right next door, right next to that person. Hopefully that is the case. And caregiving is a really hard job, but it's a job that I embraced and I loved. But I did know one thing, and this is true for everybody who is a caregiver: we have to take care of ourselves first. If we don't take care of ourselves first, we cannot take care of them. So what I did every morning, instead of taking a taxi to the hospital, I would walk, listen to music, and pray. And then I get myself centered. And then I'm in the hospital, I would take an hour and a half and go for a run. Some of you people don't think that's a good idea, but for me it was the way I was able to deal with some of the emotional stress. And then at night, I would walk home and pray and listen to music and eat. And that was the other thing, is you have to remember, you have to eat every single day, 3 meals a day. So you take care of yourself first so you can take care of them.
Home recovery. So there's 2 phases of recovery that we talk about a lot: the first 100 days and the first year. So that first 100 days, you pretty much have no immune system. It's there, but it's teeny, teeny, tiny. So you're on antibacterial, antiviral, antifungal. You wash your hands, and you wash your hands, and you wash your hands, and you wash your hands. And everybody around you needs to wash their hands. If they're sick, they can't come near you. You're not shut off in a bubble. People came to visit me, but they had to pace themselves. So Holly was smart. She'd come have a cup of tea, but she says, okay, I'm going to leave. It's an hour. I got to go because you're going to be tired. And she's right. While she was there, I was excited to see her, but as soon as she left, I was tired. So thank you for the wisdom, Holly. You have a lot of doubts and fears during this. It's a roller coaster of a recovery. You have a couple days stepping forward and then a day stepping back. You think, uh-oh, am I relapsing? Maybe it didn't work on me. It's just normal. It's normal. Hang in there. At 6 months, you feel a lot better. At a year, you feel even better. 18 months, even better. So it's a very long, slow growth, and some people lose their patience on that. Remember, he's the coach, and I had to walk in the hospital. It continued at home. So we live on this little slope of a hill. It's not a big hill, but we drove the car down that slope because I wasn't going to walk that little slope in the beginning. So I think it was the second day home, I started walking on the flat part past 1 or 2 houses, and then increasing the number of houses every day. I'm going out to the corner. Pretty soon I asked Dr. Burt, is it okay if I go walk in the park? Yeah, just don't go on the dirt yet. And eventually I said to Bill, uh-oh, this is weird. I feel like running. But before I did that, I called Ken Athens. Ken, how long before you started running? He goes, 2.5 or 3 months. I'm like, okay, coach, we can run now. I got permission from Ken. So we started slow. He had the timer. We would run 30 seconds, walk 30 seconds, run a minute, walk a minute, and we built it up. We built it up slowly. We have many restrictions in that first period. Food, no raw foods, lots of guidance. No flowers or plants because they have dirt that could bring the bacteria. You're watching out for molds. You want to stay away from the pets and gardening. And he carried a lot of Clorox wipes. So I could go out in public, but we would go to the diner for breakfast before the crowd, and he'd wipe off the table and my spoon and my coffee handle. And then on day 100, guess what I did? I ran a race. It was my first race since I got scleroderma. Yeah, that's cool. So my lovely husband bought me the VIP package where we got a breakfast and then a ride to the start line so I didn't have to stand in the cold. And see, my bib says, "I'm back." And the interviewer is it's a college news crew that came, but it felt like CNN to me. It was pretty amazing. I sent that medal to Dr. Burt in a frame with a thank you, and I said, this is your medal, this is your accomplishment, thank you so much. And the gratitude has not left me. Okay, the test results. So my skin score, ta-da, 74% improvement. I'm down to a 9. Got some 90%ers on those middle lung readings, and the magic to me is the diffusing capacity, 22-point improvement. It's not the 80% that's normal, but I'll take 74% every day of the week. I'm very, very happy. Chemo did throw me into menopause. My GERD and my Raynaud's are as bad as ever. They did not improve. But the inflammation is gone. Inside, outside, my hand function is fantastic again. I can bend over. Even in the hospital, I bent over to pick up that ugly hospital gown off the floor where wow, I can bend to the floor, and now I can squat. It's amazing to have that gone. And my yoga breath. I used to have a shallow breath. I can take a full belly yoga breath now. It's way down there. I can fill up. It's pretty amazing. Would I do it again? Absolutely, without a doubt, I would do it again. There are many days I forget I have scleroderma. I stop worrying about dying. It's not on my mind as much anymore. It comes up once in a while, but mostly I think I'm normal. I enjoy my family and my grandbabies. I have 1.5 grandbabies now. And my friends, 2 of which are here. I love you guys. Thank you for being here. Travel. We get to travel and do running. I get to love you and tell you how much I appreciate and love you, and thank you so much. It is. So much gratitude when you go through something this big and get this much result. And my lungs and my skin feel absolutely amazing. So yes, I would do it again.
She's always the good one. Yeah, she gets to get all the good stuff out there. Okay. So, is this a cure? No, it's not a cure. Its goal is to stop the progression of the disease. And that's the goal. It's not to do anything else. It's to stop the progression of the disease. Right now, some of the studies show that 5 years out, about 70% of the people have no sign of any kind of active scleroderma. Some people get some skin relief. Actually, a lot of people get skin relief because what happens is that high level of cytoxin, it kills out all the inflammation in your body, you know. So they get some relief in the skin. Cyndy is not unusual, but she's also unusual. So not everybody gets great skin relief, but some people do. Again, the idea is to stop the progression. The lungs do get some recovery for some people. In some cases they don't, but again, the object of this is to stop the progression of the disease. 30% of the people relapse, and what that really means is that sometimes they have to go back on autoimmune suppressants. There's still a lot of data that needs to be gathered about this. It doesn't look like it comes back like you would say cancer comes back full force. It comes back in different ways, and they're still trying to identify what that means. But it's usually it means that you're back on autoimmune suppressants of some sort or some kind of treatment. I've asked a lot of people who have relapsed, and across the board, every one of them said they would still do this. They would do it again. And that speaks very highly of how their body has changed. What doesn't it do? It does not improve GERD. It does not help with the hand curling, although when you do get some relief from the skin tightening, your hands do get some relief there, but it's not a cure for GERD, it's not a cure for curling, it does not stop your digestive issues. All those are done by the damage of the scleroderma prior to your stem cell transplant. Again, and I reinforce this, the main object of this is to stop the progression of the disease. If you're going downhill, if you can stop that, it means the world. So should this be an option for me? I have no idea, okay? And you'll never hear me say you should do this. What I will say to you is that leading researchers in this conference last year said this is the #1 treatment for scleroderma, for aggressive scleroderma with lung disease. That was repeated in several other sessions this year too. There is a split decision on when you should do this and when you shouldn't. If you heard Dr. First today, he said you have to be really sick and everything else. But I can tell you there's another doctor that'll tell you do it as soon as possible. So you have to make your own informed decisions here. So the rest of these are my opinions, okay? And my opinion is if you're male, if you're African American, if you're in your first 6 years and have an aggressive scleroderma, an aggressive lung disease, this should be an option you guys should take a look at, okay? Between you, your family, your doctors, you guys get to make that decision. And then we also know that the sooner the better. And that's the reason why, and here's the best way to explain that. This is how I think of scleroderma. Scleroderma is beating the hell out of you on a daily basis, right? Our job is to try to figure out a way to take the bad away from scleroderma, right? So every day you get damage, and every day this goes on, you get more and more damage. Some people don't get hit very hard, and some other people get hard, like Cyndy, get hit hard, really hard with the bat. So, you know, this is the treatment that takes away the bat for at least 70% of the people that go through it. So, how do you start and what do you do? So here's some contact information. It's in your brochures. By the way, you notice I didn't follow the slides. I apologize on that. We moved them out of order. But in there you'll find the contact information. The only current trial that's recruiting right now is ASSIST-2, and that's in there. The contact information is scleroderma.org, where they'll give you updates on what's going on. Clinicaltrials.gov will give that to you also. You can also email me at that address, and I'd be happy to tell you where to find it. And so, you know, learn, find out information, get the right information, and understand that there's a lot of different opinions, but when you make a decision, make it from facts. So we're going to talk about paying it forward. And 2 months out of the hospital, Cyndy started a support group on Facebook called Stem Cell Pioneers. And that's our way of paying it back. We had support when we went into this, but a lot of people don't have support. I will tell you that we have 500 people, a little over 500 people in that group. 50 of them are alumni that have been through this program before. And this is where you can find out information from a patient's perspective about what this is all about. We also publish all the articles. We publish everything around the world, what's going on. We have people in Australia, in Germany, in England. And it's also a good place to talk and ask questions. And we answer every question as honestly as we possibly can. It's a great resource for you. And I think something else that's really important is sometimes seeing things is more important than just reading about things. So I'd like to take a moment and I'd like to introduce you to probably 20 people in this room who've had a stem cell transplant. Would you guys like to stand up? Just stand up and we'll see how many people here have had stem cell transplants.
We got to point out Nancy first, Nancy especially.
So I want to bring Nancy up here. I'm going to bring Katrina up here because they're the oldest and the youngest, I think, in this group. And Nancy's had her stem cell transplant almost 9 years ago. She is patient number 11 in the ASSIST-1, actually even before ASSIST-1 trial. So she's patient number 11, and she actually lives in Chicago in that area, and she visits everybody that goes over there. And Katrina's from England, and she is what, about 2 months post-transplant?
12 weeks.
12 weeks post-transplant? Can you see how amazing this treatment can be? And I want you to know that everybody in this room that you just stood up are our heroes. It takes pioneers to go out there and do this kind of stuff. It takes those people to take risks in clinical trials to put their life on the lines, and those people are heroes to me. This is becoming more and more mainstream, and we like to see that, but it's from those people like Nancy 9 years ago that said, I'm willing to risk this to get us where we are today. So I want to say thank you to them, and I want to say thank you to you guys.
So 9 years ago, when I was diagnosed, they didn't know about heart catheterization. The protocol was a little bit different. But I was willing to take the risk because I really felt like I had no alternative. 9 years later, I'm working full-time, have been. I went back to work, I think, about 6 months after my transplant. part-time. You know, takes a while to get over it, but that first year. But I lead a very full, normal life. Talk to stem cell transplant patients, visit them in the hospital because I do live in Chicago. And I feel it's important that people can see that you can get better and you can have a life. And I went in, just like Bill said, to stop the progression. I didn't know how long I'd be able to live, but I don't fear death. I'm not going to die from scleroderma, I'll tell you that right now. So I volunteer. I'm very, very healthy.